It's your time to live well, and you have tuned into the Holistically Speaking podcast, where we're teaching you to be well and be whole in your body, your joy factor, in every season and pivot of your life, in your mental health and your well-being. Are you ready for this episode? Excellent. Tune in. You won't be disappointed. Hey everybody, it is your well woman practitioner LaShanna Moore with Holistically Speaking, and this is the Well Life TV. This is a special podcast episode. I think I'll probably say that every time because to me they're all special, and according to your feedback, which I appreciate, you have enjoyed them as well. But this is a special episode because we're going to be talking about the uncommon symptoms of perimenopause and menopause. Deep breath. And we're actually going to go into our moment of WEtreat because we need it. It's the beginning of the day for you. It's the end of the day for you. It's the middle of the day for you. All of you are watching at some significant point in your day. And you're listening and watching because you know that this is a very important conversation that needs to be had. So I am excited to have this conversation with you. Now, beat. As we prepare to go into this conversation, we're going to have our moment of WEtreat. Remember what that means. What is the WEtreat moment? It is our opportunity to stop where we are and what we're doing and take a deep breath. Inhale through your nose and exhale through your mouth. You hear me say this all the time, especially if you're listening to the podcast. You hear me say all of the time that this is the one weapon that you have that is freely accessible for you to use, or not weapon, but tool. It's a tool. It's artillery that you can use immediately to diffuse a moment, to help regulate your heartbeat, to reset and to restart. So before we go into this conversation, we are going to do just that. We're going to have our moment of WEtreat. I want you to place your feet flat on the floor if you can. Relax your body, relax your shoulders and your neck. Relax the muscles in your face, and let's prepare to WEtreat. A much needed moment. And when you take advantage of it, you immediately feel the difference. Now, here's the second thing that I need to do. If you know me, you already know that I really can't see you. So, putting on the glasses and all of a sudden you are clear. All right, y'all. Let me give the regular announcements before we hop into this conversation. And that is for my ladies in Houston. We are preparing for our Wellness WEtreat. Our WEtreat, August the 3rd. Save the date, August the 3rd, 2024. I am so excited. Last year was a wonderful introduction and first year of the WEtreat, women from all over. And then we even had some special visitors, sisters that came in from other parts of Texas to join us. I want to show you the highlight reel from last year. And if you are in this city or surrounding areas and you want to come and join us, we invite you to. We're elevating yet again this year with some wonderful practitioners, workshops, speakers, food, entertainment, a time to relax, a time to meet other women. If you go onto the website, you'll actually see some of the testimonials from last year. Let's go into this promo real quick so that you can see more. As y'all can see, we had a great time. And if you were there, go ahead and put in the comments section how much you enjoyed it. So our visitors that come on to catch this replay will be able to see your expressions. I am super, super excited about it. I want to hop into this conversation with you. And then, of course, if you are catching it live, you have access to write questions or concerns in the comment section. And then if not, by all means, as always, send us your email, holisticallywellcenter@gmail.com. So this is what we're talking about. 5 uncommon symptoms of peri and menopause. Now, there are more than 5, and we consider them uncommon because we know about many of the other symptoms like insomnia, a change in your libido, forgetfulness, those brain fogs that we have, hot flashes, cold sweats, all of those different mood swings. Even now, you know that heavy periods are not normal and that they can also be a part of the big change during these rites of passages. So we're going to walk through these 5, and then I'm going to also share with you signals to know when it's time to go to the doctor so that we don't underestimate whether or not you know what these rites of passages are. Let's talk about perimenopause real quick. Perimenopause is that transition right before menopause. Menopause is your one-day occurrence where you have gone successfully 12 months without a period. After that day, which is your menopause moment, your menopause day. And some women even take the time to celebrate it. Then you go into postmenopause. So after that moment, your menopause moment, you are then officially in postmenopause. So perimenopause usually will happen it ranges mid-30s, even to early 50s. Each one of you are going to have a different experience in perimenopause and menopause. And many of you younger ladies are preparing yourself by getting equipped. You've been watching the videos, you've been on the website, you've been asking the questions, and you have been engaging in conversation with your community, which is excellent. You want to be prepared while giving grace and space, knowing that your journey is going to be its own thing. Some of us are going to go through very common symptoms, and then you're going to come across women who do not speak your language. Case in point, I've shared with you that I've met a 75-year-old woman who didn't have most of the symptoms. She was only battling with insomnia, and I was so jealous. One of the common symptoms and experiences that we have in peri and menopause is definitely that weight gain. Why are these things happening? Because our bodies are changing, the hormones are changing. Your brain is also learning how to be rewired because it flows in sync with the healthy fats in our body. It flows in sync with all of our hormones: estrogen, estradiol, estriol, testosterone, prolactin, all of the different hormones in our body. We have a lot of different hormones. So you're experiencing all of these different symptoms. I'm going to pull out of the load of uncommon symptoms 5 of them. I've made my list, you already know. And let me go ahead and introduce you to them, okay? Let's talk about electric sensations, which is the first one. If you have ever felt your body sensing a shock or a sudden sharp feeling or sensation, something that feels what you could describe as electrical, then you could be experiencing a perimenopause symptom. Now, my disclaimer here is that this may or may not be accurate or the truth for many of you. This may or may not be your experience. Always consult your physician. Let me insert right there as well that your physician needs to be or should be a menopause trained physician. Why is that? You want to be able to have conversation with a physician that has been trained about these hormonal shifts and understand how the body responds biologically and pathologically. So many women who have gone through these experiences where it's like a zapping or a tingling or electric shock in your neck, in your limbs, in your head, your entire body can experience it all, one and all, or in different parts of your limbs. And this is due, what we know right now, to the fluctuation in the estrogen. Also, it is linked to the nervous system. If you've ever experienced, or you know someone who has experienced like an involuntary reboot in the body, in the brain, that's sending signals throughout the body is trying to recalibrate itself, and your body involuntarily responds to that. That is your nervous system responding to the signals that are being released through your nerves to the brain. And so the hormones start to change. They start to signal all of these different changes. And every now and then there can be a distortion, a disorienting of the signals. Our body, again, a full ecosystem of all types of nerves and electric messages and neurons and electrons, organisms, all of these things are beautifully flowing in our body and are trying to figure out how to bring homeostasis to the body. So some of the things that you may want to consider if you're having these electric sensations, yes, always consult your doctor. Never feel like you're bothering your doctor, that you called too many times, or that you're overthinking things, because if you've been a part of these pausal communities, you have already learned through voices, other voices, women's voices, and medical professionals' voices assuring you that you are not crazy. So make the call the triage, call your doctor, schedule an appointment, or have a conversation over the phone. Let them know what you're going through. So some things that you can do to reduce or prevent these electric shocks would be to make sure that you're monitoring your caffeine intake. You may want to reduce the amount of caffeine that you are eating or drinking on a daily basis. And then the relaxation techniques that we all know and love. Those are great. Why? Because it allows the body to get a full flow of oxygen in your body, helps to reduce that hyperstimulated activity that's going on in your body. If you have not been getting a lot of sleep, you also want to consider scheduling, prioritizing your sleep. All right, deep breath. All right, let's go to number 2. This has affected me. Itchy, sensitive skin. Skin, itchy, sensitive. Hormones are declining again during perimenopause. So as a result of that shift, and it's fluctuating high and low, spikes up, drops down, declines, then you start to feel these extra interesting sensations flowing through the body. One of the main productions that our body uses for in skin health is collagen. And so there is a shorter production of collagen as we're going through these different experiences. So you're going to experience things like dry skin, the itchiness. You may find that you need to change some of the oils, some of the moisturizers, or the products that you're using. I definitely recommend getting a non-chemical, non-fragrance, non-dye oil that is enriched with aloe vera. Or for those of you who like to buy the aloe vera plants, I get them every now and then, or get the aloe vera leaf and just squeeze that plant. And if you want to infuse it with a carrier oil, you can. The olive oil, the extract does such a beautiful job with moisturizing the body. And then also with the loss of collagen, our skin is thinning a little bit, which is why we start to see wrinkles and change in the elasticity of our face, more itching, more irritations. And be flexible with the reality that you may have to change out some of your products. Talk to your dermatologist, your esthetician. Ask them questions like if they are experienced and trained and skilled in working with perimenopause and menopause, so that they can advise you accordingly. I've even heard, before I go to the next one, I've even heard a few women say that calamine lotion, you all remember calamine lotion? I grew up on calamine lotion, that it may be helpful as well. So try those things. Here's one that I really wanted to highlight that may just be an experience of some women, and that is nipple discharge. It's also considered as ductastasia. It's a benign, non-cancerous condition that happens when the breast milk duct is expanding. When the milk duct DUCT expands, then it causes the walls to thicken. And so it may result in a blockage of the duct, which leads to this fluid, accumulation of this fluid. And when the fluid is accumulated, it has to be released. So it begins to discharge itself through the nipples. Now, you may also discover that you've got tender breast. You may have some breast lumps, or you may also have an inverted nipple. Your nipples inverting is a common symptom and response to the pausal seasons also. As a matter of fact, I've got a podcast on pausy breast. I'll look and see what episode number it is, and I'll put that in the show notes. But if you're watching, there is a Well Life TV version of pausy breast. And I also include visuals so that you can see what it looks like. And if you need to have a comparison chart, take a look at your breast to see if your nipples have possibly inverted during this season. You can take a deep breath because you realize that it is a normal part of entering this rite of passage. Now, having the nipple discharge does not necessarily increase. I just want to put this, I want to share this information with you, that it doesn't necessarily increase a woman's risk of breast cancer. Okay, you may have similar symptoms. Let's say those of you who have fibrocystic tissue, you have very sensitive breast tissue. You may find that the sensitivity is hyper elevated as you're going through perimenopause, menopause. When your cycles come, for those of you who still have cycles in the perimenopause phase, some women do not. Remember that we all have different experiences. So you may have had a surgical procedure, or you may have gone through a sickness that puts you right in menopause. And some of these situations may apply to you and some of them may not. So again, just like we approach wellness, I want you to approach this conversation as well, that it is unique and different for each one of us. But there is no specific treatment for ductastasia, also known as nipple discharge. Have a conversation with your doctor. Warm compressions can often be soothing when this is happening. You do want to have a conversation with your doctor. I encourage you to, because you don't want the release of the discharge to produce any type of infection. You want to know how to treat it. And then sometimes doctors may prescribe antibiotics for it. Also, let me give a shout out to MyaCare, who has provided us and continues to provide us in the community of women's health with really good information when it comes to perimenopause and menopause. I just had to give them a shout out real quick. Number 4, let's go to it. UTIs, urinary tract infections. These are infections in any part of your urinary system. That includes your kidneys, your bladder, and your urethra. Now, it is said that these UTIs can come more frequently because our urethras are very short and they're in close proximity to your rectum. And sometimes it really doesn't matter how well you are cleaning after you use the restroom. It's not always based on how great your hygiene is or is not. We do want to practice good hygiene, but because of the proximity, you can be, I'm going to say a victim of, but you can be susceptible. Let's say that you can be susceptible to a UTI. It can cause burning and pain. sensation when you are urinating and you find yourself urinating frequently, well, this can also be due to hormonal changes, declining in the estrogen, a decline in the estrogen levels. This will affect the bladder, it will affect the vaginal walls, and it will affect the urethra, and it makes them more susceptible to infection. So we want to be mindful of how we are wiping when we go to the restroom. Your doctor may prescribe antibiotics. In nutrition, we have talked about using probiotics, drinking plenty of water, staying hydrated, making sure that you're wiping from the front to back. That's the medical suggestion. I suggest that you use completely separate wiping regimens, that your front has its own, okay, and the back has its own. But the decline in the estrogen levels, which is affecting the lining of the bladder, UTIs are very, very common. It's also been prescribed by a lot of doctors and nurses for women who want to consider hormone replacement therapy. And we've talked about this in a previous podcast as well, that hormone replacement therapy could be an option for you. We have long debunked the idea that HRT, hormone replacement therapy, is the cause for breast cancer. After extensive research, over 20 years of research, that myth that started many, many years ago, just from a small case study that was not really quantitative, the myth has been debunked. However, yes, have the conversation with your doctor about it. And again, I suggest that it is a doctor who is trained in the pausals: perimenopause, menopause, postmenopause. All right, let's hit the last one. Number 5, body odor changes. Take a deep breath. It is very common that you're going to sniff and find that your body may be producing unpleasant aromas. Take a beat, because it is not as uncommon as you may think. And it's not just you, it's many women. Now, I always see the jokes online, and they are funny. The jokes online about the all natural deodorants and how they just not cutting it. They're not doing the job. I've seen jokes saying you need some aluminum because whatever you're using is not working. You may have felt that way yourself as well. We know through research and through chemical transfer through the skin that aluminum is no longer an ingredient that we need to continue using, which is found heavily in our deodorants. But your body odor is changing during perimenopause. It's becoming more sensitive. It's becoming more intense, consequently becoming a little bit more unpleasant. The change in your sweat, also, which can make you more susceptible to bacterias. Bacterias live on the skin, which are responsible for producing the body odor. Estrogen and progesterone are influencing your pH level, the pH level of the skin. So you are going to find that the odors of your body and your body parts are changing. And yes, there are times that because of these changes and the way that these chemicals are rebalancing or trying to find balance, that every now and then they may produce a bacteria. Deep breath. Don't fret. We already know that bacteria can be a very natural experience. So some tips that we can use here. Definitely make sure that you're bathing. Bathe regularly. Know that it is not abnormal that you may have to take more than one bath or shower a day. Make sure that you are using a deodorant, an antiperspirant, which you may have to kind of shop around and look at some new brands that you've not considered before. You may have to, this is the time for us to research, look at the ingredients, try them out, do a trial and error, and give some grace, because what you may try may not work, and you can know, you have to discontinue using it. But just give yourself some grace in that regard. Make sure that you're wearing breathable fabrics. We already know about the color of our underwear. Let your vagina breathe at night. If you can go to bed and you feel comfortable enough with allowing the vajayjay to breathe overnight while you're sleeping. Also, the foods that we eat can affect the pH of our vagina. Different spices, different herbs, seafoods can definitely affect things that are high in magnesium, in iodine, can affect our vaginal pH and the discharge that you may see. Now, two sides of this. Discharge is natural. There's certain discharges that you do want to pay attention to when it becomes very dark brown, when it becomes black. Even sometimes odors, just like a small pungent, tangy odor, is natural. If, however, you are concerned, make the call, schedule the appointment. I really want to normalize that. And that's why I'm repeating it. I want to normalize the fact that if you have a concern, you have a right to address it. And there is no such thing as too many times. Just like new mothers, the elders or more experienced mothers will joke around with new moms saying you're calling the doctor too much, or you feel hyper vigilant about what your baby is going through, and you make the calls and to the health team or to the village constantly. I say better safe than sorry. Do what works for you. Let's end with this: when to see a doctor. Now, we've been doing a lot of advocating about reproductive health. We've been doing a lot of advocating about misdiagnosis. I want you to call your doctor if you feel or are concerned about anything, but definitely see the doctor if these symptoms are persisting after you have tried to reduce them or to eliminate them with some of the tips that I've shared today, or with a medication or a tool that your healthcare professional or your holistic practitioner may recommend. If it seems that it is continuing or worsening, contact your doctor. If you are still in reproductive stages where you're wanting to get pregnant or consider pregnancy, watch these things, watch these symptoms, monitor them, everybody. Journal, make notation. If you are younger than 40 and you suspect that you're going through some premature ovarian insufficiency, contact your doctor. If you're having infections or inflammation constantly in your vagina, your bladder, breast pain, burning, itching, call your doctor. If your hot flashes are severe and intolerable, extreme vaginal dryness, call your doctor, your practitioner, your chiropractor, your nurse practitioner, your holistic practitioner. Call them. When you notice that your periods are changing, and they will, sometimes they happen farther apart, sometimes they happen more frequently, to make sure that you know that this is why these things are happening, call your doctor. And ladies and gentlemen, that concludes the conversation about 5 uncommon signs and symptoms of perimenopause and menopause. I hope that helped. I hope it helped you to breathe a little bit, to know that you're not alone, you're not crazy, and that sometimes the uncommon in your circle may actually be more common than you think. I want you to stay connected. Let's be social. Subscribe to this channel, Well Life TV. If you're listening, subscribe to Holistically Speaking. Follow us on Instagram at Holistically Well Center, and go to the website. That is always the most important. That is our intellectual property right there. That is our baby, our brand, at holisticallywell.co. That's holistic with a W. Remember, y'all, be well and be whole. It is my pleasure to serve you at all times in this capacity. And make sure that you reach out to us and let us know how you're enjoying this podcast. All right, be well and be whole.